So much goes into protecting all of us from COVID-19. Frontline workers are heroes responsible for saving lives during the pandemic. And ABC4's medical correspondent Saray Chin has more on the local efforts to curb coronavirus.
During the pandemic, we've heard a lot of terms such as frontline workers, and that includes community health workers. We have joining us today is Tessa Acker, community health worker liaison with the health department here in Utah, COVID active response team, and also Kathy Wolsfeld, community health worker and with Calvary Baptist Church. Thank you so much for being here. I want to start with Tessa. What exactly is a community health worker?
So community health workers are leaders in their community. They are the trusted members on the ground who help to educate and empower their communities. They really are sort of that bridge between their communities and different health and social resources. They help them navigate systems. They help to provide care in culturally and linguistically competent ways. And they truly are just those trusted members who provide support and are embedded in the community and understand their communities.
And one of those trusted members is Kathy. Kathy, explain your role and response to the pandemic in your community.
Well, my role as a community health worker is a little bit different than others as far as I am not in a clinic setting. I work through and represent Calvary Baptist Church in downtown Salt Lake City, and I work with the African American community. And so in our community, I understand the barriers that we face, and I understand that, the marginalized way that we are treated, and especially in the healthcare field. And so I am blessed enough to be associated with the AHEC, the Area Health Education Centers program at the University of Utah, and we work with their scholars in educating the medical students in their first and second year on how to be sensitive to the community that they're not familiar with. And so we have 5 underserved communities represented with this project, and we are teaching and educating these fresh first and second year medical students and how to relate in the medical setting and how valuable community health workers are in order to bridge that gap, because we understand, we know the way that people think and the way that they want to be treated.
Tessa, it's so essential to have these health workers around, the community health workers, because you can see that they are bridging that gap. How do you think the response is going so far?
They have been an absolute vital part of our with the Utah Department of Health. As Kathy mentioned, they truly understand, the conditions in which their communities live and work and play. They understand the barriers that they're facing, and they're able to help them sort of navigate those systems. So when it comes to where do I go to get tested, they help provide that information in their own language. They help to navigate those systems. When it comes to the vaccine, they help answer those frequently asked questions about the vaccine. They really serve as those role models in how to protect yourself and how to, really navigate this really difficult pandemic that has been hitting these communities especially hard. And so they just have been such an amazing advocate and such an amazing workforce. They truly are on the front line every day dealing with these communities. And we could not, thank them enough for their important work.
Tessa, thank you so much. What is the website where people can go to find out more information?
So there's information about our diverse communities and multilingual communities at coronavirus.utah.gov. And if you want to learn more about community health workers or get involved as a community health worker, you can also check out the Utah Public Health Association Community Health Worker section.
Excellent. We'll have a link on our website, abc4.com. Tessa and Kathy, thank you so much for everything you're doing in our community.
Thank you.